Back here on this Saturday morning, Sports Medicine Weekly. Steve Kashul, Dr. Brian Cole. Our website is sportsmedicineweekly.com. Time now for our Ask the Doctor segment, giving listeners the opportunity to have Dr. Cole address their specific sports injury issues. It's very easy. You can send your directions directly through our website, sportsmedicineweekly.com. Go to our homepage on our website. Look for the picture of Dr. Cole and yours truly on the homepage on the right side, and you can click on that link. Are you ready for some good questions, Dr. Cole?
Challenge me, Steve.
Question number one. What are your opinions on physician use of social media? How do you utilize social media in your practice?
So, this is a really interesting area, and at its heart, social media for physicians really should be for education rather than necessarily promotion, right? So we've had a resurgence of attention on social media. I can tell you in orthopedic surgery, there's been some recent research looking at influencers and so forth, and I will just tell you that the biggest impact that we have on social media has to do with our research. So there was a recent report that looked at who has the most significant impact or influences sort of the outside world on educational content and social media. And the biggest factor was articles published that get sort of looked at in the literature that people quote and other physicians quote and so forth. And that was actually more influential than anything we do on Instagram or Twitter or Facebook and so forth. That being said, I think that the major goal should be sort of unbiased presentation of educational content, and if people want to follow that, they'll choose to do so because they'll think that you're sort of an authentic source. But I will tell you, social media has become enormous in the area of healthcare, and I don't have too many colleagues that aren't involved in some fashion using either Facebook, Twitter, or Instagram. And the way we approach it is we kind of do it multifactorial. We use all of those things, and our handles are all out there, and Shoulder Knee Doc on Instagram and Facebook for Sports Medicine Weekly and Twitter. But I will tell you that we want to be a good provider of content that people find interesting, much like, why we want to develop content for this show. So it has a big role, but maybe a little different than developing a brand in the classic sense.
All righty. Good stuff. Good stuff. I'm going to jump to question 2 right here, Doc. Okay. Does exercise benefit men and women differently?
So definitely a controversial area. There was some recent research that looked at a randomized trial that looked at exercise, the effect on weight and body composition, sort of percent body fat and muscle between men and women. And it looked at individuals between the ages of 40 to 75. And one of the things that they ascertained is that when they looked at the comparable effects of exercise in men versus women, they actually saw that men experienced greater loss of overall and abdominal fat, but the differences between the genders weren't significant. And the important thing is that men tend to carry abdominal fat, we call visceral fat, so you can actually look not like you're overweight or carrying excess fat, but it can be sort of buried in your visceral fat, and that is a high risk factor for cardiac or heart disease. So the good news is that what men lost was a similar amount to women, but they lost more abdominal fat, and that's actually very important. There really wasn't much of a difference in the effect of exercise on body composition by age among women or menopausal status. And then finally, what they also showed is that individuals who are overweight or obese at their baseline lost more weight than those of normal weight. So I think that's kind of intuitive. When people come in and they're worse off, they have much more to lose, they do much better. The challenge is that when people get going in a weight loss program is they usually sort of asymptote or peak out where they reach a threshold where it becomes increasingly challenging to lose weight. So it depends on where you start on the curve. But not huge differences in the amounts of weight between men and women, but men tended to lose it more in the visceral area, which is around your organs, your intestines, which is actually very important. So something to keep your eye on.